Welcome to Never Too Late for Fitness Radio, bringing baby boomers proven strategies and innovative products for getting fit, staying fit, so you can live a longer, healthier, and happier life. Here's your host, best-selling author and fitness advocate, Phil Ferris.
Welcome to our show. The goal of Never Too Late for Fitness Radio is to showcase health and fitness options that can help baby boomers get fit, stay fit, and adapt a healthy lifestyle. Now, many people I talk to about getting fit say they want to get fit and start leading a healthier life, but they're too sick, too tired, and in too much pain to do a fitness program. Since starting a program is usually the biggest obstacles for many, I invited my next guest to talk about what he does to help baby boomers get on and stay on a successful health and fitness program. My guest today is Dr. Thomas Mitchell, owner and clinic director of Chicago Institute for Health and Wellness with locations in Elgin and West Dundee, Illinois. Dr. Mitchell describes himself as a natural healthcare practitioner, certified chiropractic sports physician, chiropractic physician, a functional rehabilitative specialist, and is certified in applied kinesiology. Clinical nutrition is another area of proficiency, practice, and general interest of his. Combining kinesiology skills with chiropractic expertise, Dr. Mitchell has a reputation of frequently being able to produce effective results where other practitioners have achieved only partial results. His watchwords, well-earned and thoroughly employed, have become results-driven healthcare. He's also a very disciplined athlete and drug-free powerlifter who has broken the state and American records for powerlifting in his weight class. Thanks for joining us today, Dr. Mitchell.
Thanks for having me, Phil. I appreciate it.
Not a problem. I think that the listeners would be interested in learning about how your damaged back influence your personal fitness program, as well as your approach to healthcare and chiropractic medicine. Could you share how an MRI examination when you were in chiropractic school impacted your approach to both health and fitness?
Sure. You know, I was 22 years old at the time, and it was a research study. And I went into they were offering free MRIs, and I just went and did it. And they stopped the MRI, or they stopped me on the way out and said, you may want to come look at your back. And what was discovered was multiple herniated discs and something called Schmorl's nodes, which is where the disc herniation actually fractures the end plate of the vertebrae. At the time, I had no back pain, but it certainly scares you a little bit. So I really had to start. Luckily, I was in chiropractic school, so I had the resources around me to do the research that I needed to do, and I just changed my approach to how I exercised and how I trained, and it was more about it became more about the preservation of health than the avoidance of a back issue or the avoidance of some disease process. So it really changed the way, instead of being reactive, it made me proactive in terms of what I do for myself, which then translates to the patients that I see.
Can you give an example as to how, perhaps a specific approach to, because you were a powerlifter, you were working out at that time, a specific example of how you changed your working out and fitness regimen at that time?
Sure. To give you a little bit of background, I started powerlifting when I was young, and I think my first meet might have been as a freshman in high school. So by the time I was in chiropractic school, I think I had a couple of New York State records, and I was good at it, and I worked hard at it. But I had to change and realize that most of the people that I was competing against weren't very old. They were in their mid-20s. And once you hit your 30s and 40s, people were getting injured very quickly. People were getting injured, and that's the end of their career. And then they would talk about what they used to be able to do instead of what they are currently being able to do. So the way I changed it is I just applied biomechanics and neurology, the way our brain controls our body. And I created a concept called neurostabilization training. And basically it's the more stable your joints are, the more stable your body is, the stronger it can become without injuries occurring. So it decreases the frequency of injuries and allows your body to do pretty amazing things. So since I started that, which was almost 20 years ago now, I've never been injured. I still power lift. In fact, last Saturday, which was, not last Saturday, March 4th in 2017, I actually broke the world record for bench press in my weight class in the World Drug-Free Powerlifting Federation. So it's just consistency over time.
Well, that's pretty impressive. So, you have herniated disc, and you're working out very heavy, and there's no back pain.
No back pain, no shoulder pain. And it's not so much even the heavy. It is the heavy, but it's I work out very intensively, and but as long as my body's stable, it can handle those things. What I find is that in the baby boomer generation, you're kind of finding old injuries that have stopped people from doing what they want to do. So you have to kind of get that stability and get that those injuries to heal properly, and then honestly, there's no restrictions on what people could do of any age.
Okay. Now I found it interesting that although it was your back that influenced your healthcare journey, most of your baby boomer patients don't come to you about back pain. Can you kind of describe what are some of the most common health issues that cause baby boomers to seek you out?
Yeah, you're right. Actually, I am a chiropractor, so we do back pain and we do neuromusculoskeletal care, like bones, muscles, joints, but we also do a lot of functional medicine. And really, I think what people come to me for is they come to me because they want to find the answers to the why behind their health issues. Like, why is this happening? And then they want results. Like, how do I get this better? Not just how do I have less pain, because that comes with it sometimes, but they want to reduce their dependency on medication. They want to live, honestly, they just want to live their lives without the encumbrances of what they think aging is. And so a perfect example, I had an 87-year-old man yesterday tell me he now feels like he's 21. Now, this gentleman has had colon cancer and prostate cancer. He's had multiple back surgeries. He's had knee replacement. I mean, he's had a lot of hardship medically in his life, and he literally sat in front of me, and the only thing that he feels is a little tingling in his right hand. That's it. Pretty awesome.
That is impressive. What are some of the other issues that people might come to you that most people wouldn't perhaps associate a chiropractor being the person that they would go to for health issues and hand pain?
Sure. All kinds of things, from high blood pressure and high cholesterol to weight issues, diabetes, autoimmune disorders seem to be a big thing in my office right now. We just seem to be getting a lot of patients that we're working on stabilizing autoimmune disorders, so reducing inflammation. The fun thing about what I do is every person that walks through the door is very unique, and you just figure out what's going on with them, and you just start to apply an approach that allows them to be healthy. So we really work on a full gambit of things here. Okay,
now one of the things that, Dr. Mitchell, that stuck out from your practice is that your use of progressive objective tests. And maybe you could kind of share with my listeners, why is testing so important to you and your patients?
Well, it allows, honestly, Phil, it allows me to hold patients accountable for the things that we need them to do, as well as it allows them to hold me accountable for the things that I'm asking them to do. So there's a test. We have something called a bioimpedance analysis in our office, and it's a very easy, clinically accurate, clinically relevant test that tests for body composition, so body fat, lean tissue, intracellular water, extracellular water. It gives us all kinds of cool information that we can, if we have somebody working a program that's structured for them, then that objective data, something that we can do quick and easy, that objective data allows us, again, to hold each other accountable and to change gears when something's not working. But then we also have the full gamut. We run a lot of blood work, or we take into account a lot of blood work or hormone panels or whatever's necessary to get that person better. The unique part of what I do, because the tests aren't necessarily unique, is the approach that we try to stem off diseases as opposed to going, okay, you're okay, and now you have this disease. Well, you can see that transition in the objective data far before you can see it actually even in an exam. So we can see things going wrong and stop them before they go wrong, which is not really how the allopathic model works or the typical general practitioner works. There has to be this black and white number where you're diseased or you're not diseased. Well, there's all that wiggle room in there, and that's really where we shine.
Okay. Perhaps you can give an example of how you use a particular area of a test or results of a test that may have identified something that allows you to be proactive in heading off a disease or potential disease.
Sure. Honestly, I have a great example. It happened not yesterday. That was an 87-year-old man. A gentleman in his mid-50s. He actually came to me as a diabetic. He's 58. And he came to me as a diabetic with a hemoglobin A1C of an 8.8, which is high. 6.5 is diabetes. He was 310 pounds. And we ran all of his blood work, and we just did the typical workup. And what we found is that his kidneys were actually starting to slow down and weren't working great. Along with that came high blood pressure, and he had high cholesterol and all these things. And so I saw him in my office on Wednesday, and this is now 5 months later because he started in October. His goal was to be below 270 pounds by Christmas, and he started mid-October. The day before Christmas, or 2 days before Christmas, he was at 268. So then He is now at 249. He's off all of his medication, and his last A1C is a 5.5, which is better than mine. But if we didn't work help him with his kidney function, that was kind of hampering a lot of the process. And once we fixed that, or helped him fix that, then he was able to work on the other things so aggressively that he's no longer a diabetic. I mean, I guess technically he's a diabetic, but he's not. He doesn't have any medication, and his numbers are better than mine, so I can't really call him a diabetic anymore.
Okay, that's great. Now, you made the reference to how you're different than a lot of other, the typical doctor. And most baby boomers, myself included, are used to going to the doctor's office and then leaving with a prescription and a card saying, please check back with me in 6 months. That's not necessarily the case with your office. And your patients who are looking to have a program to improve their health and fitness leave with what you call an individual structured health care program. Can you talk about the specifics that go into that and how you use it to help patients accomplish their goals?
Sure. I guess what I would say is everyone that I see gets a program structured for them, and that's based off all the objective data that we have, which is the exam, the blood work, the hormone panels, the bioimpedance analysis, whatever that is. Whatever is necessary actually for them. Could be x-rays, could be an MRI, could be anything. We do a consultation, we get all the objective data, and then we just lay out a plan that we think fits them best. But then we coach them through it. So basically one of the things I call what I do is health coaching, because we sit down, we rerun the objective data, but you can't run blood work once a week or once every couple weeks, so we use the bioimpedance analysis a lot. And we just start working through that objective data so that, again, we can hold each other accountable, but if you can get the objective data to go in the right direction, the person doesn't get a choice but to get healthier. Like their bodies are just getting healthier, so they're losing weight, they're feeling better. Things are just going better. But everything is individualized because there's no one size fits all program out there that actually works. There's tons of those programs out there, but if any one of them worked for everybody, that would be the last one we needed, right? And that's just not the case out there.
Okay, well, no matter how good the program is, everyone runs into obstacles. Otherwise every program would be successful. What are some of the most common obstacles that your patients encounter, and how do you help them overcome those obstacles?
Their lifestyle a lot of times is an obstacle, and their spheres of influence and their cycles of behavior are obstacles. So we coach them through it. We give them options. We give them techniques and tips and tricks to get through certain parts of life that are there to be obstacles for them. If we have them on a nutritional program and it's Christmas Day, what do they do? So we discuss all that. So we don't expect everybody to be experts in healthcare. That's what we do, but we do expect them to learn to be experts in themselves and to understand what works for them and their bodies and their lifestyle. Because once they have that, once we can teach them that, then they can overcome almost anything. It's just kind of it's important for them to take control and be accountable for their own health, and then they overcome everything that's thrown their way. Okay.
Again, because I like concrete examples, can you give me
Sure.
an example of an issue that someone comes to you and say, I'm not losing weight, or I still have pain, or I still have stiffness, whatever that is, and how you help them get through I just break through the wall so that they can actually accomplish what they want to accomplish.
Concrete example on that is purely coaching and education of figuring out the why behind. Let's say somebody would come in and say, "Hey, I'm still having knee pain." Well, why are they having knee pain? Well, you determine what that is. You apply an approach, but you have to educate them on the things that they have to do to help themselves stay out of pain. The baby boomer generation, at least from my perspective, they're actually quite good at following directions and taking kind of what a doctor says and really taking it to heart and really doing it. Sometimes that's to their detriment. If they're on a medication, their doctor just says, "Hey, you're going to go on this medication," then all of a sudden they're on that medication for the rest of their life without researching it, and that's not so great. But typically they follow directions so well, and so once you give them the why behind what they need to do, then again those obstacles aren't there anymore. The goal of this office, the goal of what we do is to remove those obstacles so they don't actually have anything to overcome, and when they do, we just coach them through that and get them to the other side of it, and then they keep losing weight, or their pain is no longer there, whatever the case may be. That it's our job to educate that person so they can overcome those.
Okay. For the baby boomer that wants to get back into fitness and they haven't for a long time, what are the first couple of things that they should be doing to start a fitness program?
Well, you always have to have the blanket statement, talk to your general practitioner and all those things. But really, ideal things for people to start is to start drinking more water. And I say anywhere between 64 and 96 ounces a day. But just start walking. Just start getting their body moving so it can condition their body and their muscles to start to work. And you can pump fluids through so that their bodies are pumping fluids, blood's pumping, they're eliminating lactic acid, everything starts to move freely again. And so that's the best place to start. That I found for my patients, if they're just getting back into an exercise program, it's literally start with a 5-minute walk, or start with depending on their health conditions or the condition of their body. You just start slow, and before you know it, with enough water and enough walking, you're running Ironmans a year and a half later. Who knows?
Yeah. So it's when you talk about, based on your physical condition, some people it's go out for a walk. For a walk, for some people it is 5 minutes. For other people it's 2 hours. I mean,
correct.
What is relative to you? And then the idea, I guess, is the next level. Once you get a certain level of fitness, is what would be the next level? Once they're up and they're able to walk for 30 minutes or an hour without pain, what would be kind of the next kind of level of fitness that you would try and add to that?
So it's dependent on the individual, I would say. But what I tell people is find an activity that keeps you active, but is something you really enjoy doing. It could be playing pickleball, it could be walking, it could be running, it could be climbing trees. That part I don't care too much about. It's more about do something you really enjoy, because then you look forward to it. It's not a chore anymore. It's not a thing that you have to do. It's not a necessary evil. It's like the thing that helps you get through the day. It clears your head. You feel better afterwards, and that is individual for everyone. Some people it's yoga and classes, and some people it's weight training and or resistance training, and some people it's just continuing to walk and listen to music or their books on tape, and they just so the next level is always find something you really enjoy doing, because if you can walk a half an hour to an hour consistently, then you're ready to move to the next step of, okay, let's play pickleball, see if I like it, or whatever it may be. You definitely want to push yourself, but the only way to make it sustainable is if you enjoy it. Okay.
Now, how important is nutrition in the programs that you outline for people, and how do you address that?
Nutrition is 75 to 80% of what we do, or the program at which we put people on. It's critically important. We address it in any number of ways, but again, we don't. I'm not a dietitian, so I don't tell people to eat 12 almonds and a half a slice of bread, and I just don't do that. It's not how my brain works. My job is to get them in a nutritional program that their bodies start to break down, absorb, utilize nutrients better, and then eliminate properly. And that's to get them healthier. I mean, it's as simple as that. So there are some basic things that most people should avoid. That I tell most people to avoid: dairy, wheat, sugar being number one. Actually, I should always say that first, because sugar in our diets are absolutely, not only are they adding weight to our bodies, but it's absolutely slowly killing us. And then, so those three: sugar, dairy, wheat, and then there's a whole bunch of other things that are more specific to the individual. Some people have sensitivities to different foods like eggs or soy, or who knows what. But nutrition, 80% of what we do in terms of helping people get healthy is making sure their nutrition is correct.
Okay. And so getting them to eat right, avoid foods that have long-term bad consequences for the body, drinking water, moving. So I guess the next question I have is there's a lot of misinformation out there about healthcare choices, chiropractic medicine specifically. So what do you find is the biggest misconception that people have about you, your office, and your program?
Well, because by definition I'm a chiropractor, the misconception is that we just treat backs, and that's what people think of going to a chiropractor for. Personally, I take what I do very, very seriously, in the sense that I feel like we should be, because as a chiropractor I don't have access to prescribed medication. So if I'm going to help somebody with their high blood pressure, we have to do it correctly. Like, I don't have anything to give them that just lowers their blood pressure and they can go on with their whatever the thing is that raises their blood pressure. So the misconception is that we can only do certain things. And I will say this, there are certain chiropractors that's all they do is they treat the back and they treat back pain, and that's okay too. Walking into this office, most people, at least my office or this clinic is 95% of this office is referral based. So most people that are walking through the door have researched me online, have talked to friends and family that have gotten better, and they're here to get better. So they kind of know what they're stepping into, which is a lifestyle change, which is the ability to kind of take their life back. And in reality, that's what we provide.
Okay. Now, what's the most common, I guess, frequent comment that you hear from clients after they've completed a program and achieved their goals? What do they say about the program and what it's been like for them?
Yeah, the most common phrase is "thank you." That's it. And what I tell them is that I didn't do it. Actually, they did it. I just helped them. I just gave them a roadmap and coached them through it. But in reality, they've done it. And it's empowering for them to have the control and the education to do it themselves. So honestly, the most common thing I hear is "thank you," which then I give them a hug and I see them when hopefully before the next time something happens, but just to maintain them. But in reality, like, it's a pretty cool environment when people come to the office because they want to be here. They're not in dragging pain or in terrible shape, and they come here and they're doing great. So that's the most common thing I hear.
That's great, because it's what I've gotten from our discussion is it's not just come in and here's the Band-Aid, here's the prescription. It's let's dig in and figure out the why behind what's going on. Let's do this together, which is, let's you and I look at the data, look at what's going on. So we're making some choices that empower the person to be able to understand what's going on with his body outside the office, where 90% of the magic actually happens is when they're back home or on the job, when they actually have to apply what they're doing in their lifestyle. And it's not dependent on the doctor. It's based on what you're able to give them that allows them to change their life, which gives them the results they want.
You said it perfectly. That's exactly what it is. Allowing them to be empowered to, and it's not dependent on me. It's dependent on them, and giving them the tools to do it.
And they just have to have the mindset, I would guess, that this is, they have to own up the fact that it's their lifestyle that's got them where they are. Therefore, they can control their lifestyle.
Right. It's true. But if they don't do that, they can't be helped anyways. They can get a pill that can help them. They can or can lower their cholesterol or lower their blood pressure or control their blood sugar. They can get those things. But if they don't own the fact that it's on them, then I can't help them actually, because it's really for them to understand and take that power back. And when they do, though, I tell you, when you see somebody really get it and light up because they understand that now they are in control of their health, control of their health care, and can pick the doctors that they want, that because they're seeing them because for a specific purpose, boy, there's nothing like that. It's really a game changer.
Well, that's great, and I want to thank you so much for spending all the time explaining what you do at your center and your approach to health and fitness. If people want to connect with you or get more information on the Institute for Health and Wellness, where should they go, Dr. Mitchell?
They can just look us up online at chicagohealthandwellness.com. I know it's a pretty long URL code or URL domain name or whatever, but chicagohealthandwellness.com. It'll bring you right to our website, and all the information that you're looking for is there. You can subscribe to a blog. You can download the book I wrote a few years ago for free. There's resources on there, and then our addresses and phone numbers are on there, and and we'd be happy to help them.
That's great. And the book is The Mitchell Principles, A Guide to Elite Performance and Healthy Lifestyle. And I did get a copy, and I think it's a very, very good read for anyone, not just baby boomers, but to give you the insights that you need to take control of your health and fitness. So I highly recommend that. So again, thank you very much for sharing your information, and you have a great and wonderful day.
Thanks, Phil. Again, much appreciated. You have a great day also.
You've been listening to Never Too Late for Fitness Radio, hosted by Phil Ferris. To learn more about the guests or resources on our show today, or to listen to past episodes, go to nevertoolateforfitness.com.